So we're here on behalf of the premiers of all provinces and territories to call on the federal government to respond to the priorities and needs of all Canadians. First and most important, by contributing its fair share of health spending in the country, we ask the federal government to increase its share from 22% to 35%. Secondly, we ask the federal government to come to the aid of provinces having significant revenue decrease like Alberta by easing the federal stabilization program. Third and finally, we ask the federal government to increase its contribution to infrastructure investment. So what we're asking is a fair and equitable partnership with the federal government.
As the demand is increasing, the support from the federal government has been going down. We have increases of approximately 5 to 6% year after year after year. Just think of it, folks. That's almost a 25% increase over a 5-year period. People need confidence that we have a strong healthcare system will mean a strong economy, and we'll all get through this together.
Provincial taxpayers are carrying nearly 80% of the burden in a system that becomes more costly as our population ages, and that is more clear now than ever in the midst of the worst public health crisis in a century. We all say during COVID that we need to be all in this together. And while we do appreciate many of the recent actions of the Government of Canada, fundamentally, as my colleagues have pointed out, our ability at the provincial level to pay for the quality of care that people rightfully need and expect is increasingly limited in a bargain that was supposed to be a 50-50 federal-provincial share of health care costs when Medicare was formalized as a national priority 5 decades ago.
If your foundation of your house is beginning to crumble, do you redecorate the second-floor sitting room? We need a federal government to focus on the fundamentals, the foundation, and the foundation of our healthcare system surely rests on our ability to get care when we need it in a timely manner. The federal government's contribution levels are the lowest they've been. The demand is the highest it's been prior to COVID. Now we have an opportunity to focus on fixing the system. This is what we must do as partners. The premiers have come together from every political party we represent, and there are many, unanimous on this. And we understand the problem because we're on the front line, as Doug alluded to, we're on the front line delivering care. We understand the pain that people feel when they wait because we get it. But we need the federal government now to respond as a partner should, step up, resume its rightful responsibilities on this important, critical issue.